And like even when I first got in the business, the best plan was like a $500 deductible. Now that plan has now turned into like a $1,500 deductible. So the writing was on the wall for me. It's like, am I even going to have a job here in the next 5 or 10 years? Because this is just going to be such a big expense. But instead, I decided to kind of go back to, what I learned, during my internship at Iowa. I just, professional development and read and connect with people and things like that. I got connected with Health Rosetta. I got connected with other advisors that were kind of doing things a little differently than, what we refer to now as the status quo, and really just dove into understanding all the components of a health plan, how health insurers make money, how pharmacy benefit managers make money, PPO and HMO, network agreements make money, and how employers are always on the losing end of all of this. And it seems like the health insurers are always on the winning end, or how I, tell employers are, health insurance carriers are like casinos, they don't lose money. And so that's what kind of kickstarted, my endeavor.
We are excited today to have as our guest Colton Storla, who's with Northwest Partners, and he's somebody that's become a great partner, if you'll pardon the pun, in working with us to make HELPcare clinic membership with an insurance plan or wrapped within an insurance plan be a reality, and to really meet the needs of our members as well as their employers. And so, Dan, we're excited to have Colton be with us today, and so take it away.
Nice to have you here, Colton. We really appreciate you coming.
Yeah, thank you.
Yeah, why don't you start by telling us something about yourself, your career path, what work you do?
Well, I was born and raised in Marion, Iowa, and didn't travel far after high school. Played all the sports, but knew I wanted to play college football. So I went to college. Didn't really know what I wanted to do. But hey, I made it to college and I was the first in my family, so that was great. Thought about getting into architecture, law enforcement, but as I was starting, my football workouts and getting to know the coaches and the team, I quickly kind of fell in love with, the strength and conditioning side of things. Really, had a great relationship with my strength and conditioning coach. And I'm like, it would be kind of cool to do what he does. So I was kind of on that career path throughout my 4 years at college, and, with the goal of wanting to, train college athletes after graduation. So I graduated in 4 years and I went off to the University of Iowa to get some more experience and did an internship at the University of Iowa, strength conditioning program and their football team. And that was a great experience, both personally and professionally. It wasn't a walk in the park. I was there, 4 or 5 o'clock in the morning, setting up workouts and making sure everything was set up perfectly before the players came in. I had to read a lot of books on just, personal development and professional development in the field. Then that was coming to an end, and I was, set to get some more experience in that, get my master's degree because I knew I needed that. But then just ultimately ended up at a crossroads, and my student loans were knocking on my back door, and I was just like, is this really what I want to do? Is it more of a hobby? And had several conversations with mentors and people in my network, and one gentleman that I had a lot of trust with, he suggested that I ask Greg Dunn for a job. I didn't know exactly what he did, but I did know he worked in insurance and he owned his own brokerage agency in Cedar Rapids, Iowa. So I took this mentor's advice and I asked him for a job. After, learning a little bit more about what it was going to be entail, and he's just like, you got to be able to talk to people, you're going to have to make phone calls, you're going to have to do all these things. And so he ended up hiring me on. I didn't have a health and life license or anything, so he definitely took a chance on me, which I'm very grateful for. And then that kind of is where my career started.
So, and describe that career. What exactly do you do?
Yeah, so that started off as, there's no employee benefits consulting or broker or insurance agent, one-on-one guide that you read and then you're an expert. Everybody does things differently. And, here in Iowa, we have a lot of small businesses, and we do have some mid-sized and large groups, but how you kind of get started, and most people get started, is you work with small employers. And so I was handed some small employer accounts and I kind of, found my own, just knocking on doors. And I would build their employee benefits package for them from their health, dental, vision, disability, life insurance, things like that. And that's when they, quickly kind of became fascinated by the health insurance side of things because that's where a lot of the expense was. And, costs continued to go up. And I was having to go to my clients or potential clients, meetings and discuss, your costs are going up with Blue Cross and Blue Shield or United Healthcare or whoever the carrier is. We can raise deductibles to try and offset those costs. We can limit networks. We can quote alternative plans. But at the end of the day, the cost just kept going up and up and up. And like even when I first got into business, the best plan was like a $500 deductible. Now that plan has now turned into like a $1,500 deductible. So the writing was on the wall for me. It's like, am I even going to have a job here in the next 5 or 10 years? Because this is just going to be such a big expense. But instead, I decided to kind of go back to, what I learned, during my internship at Iowa. I just, professional development and read and connect with people and things like that. I got connected with Health Rosetta. I got connected with other advisors that were kind of doing things a little differently than, what we refer to now as the status quo, and really just dove into understanding all the components of a health plan, how health insurers make money, how pharmacy benefit managers make money, PPO and HMO, network agreements make money, and how employers are always on the losing end of all of this. And it seems like the health insurers are always on the winning end. Or how I, tell employers are, health insurance carriers are like casinos, they don't lose money. And so that's what kind of kickstarted, my endeavor now. And I spend a lot of my time just, trying to help employers either improve their benefits or lower their costs as much as possible, and really just creating a health plan that benefits them versus these big insurance carriers that are just raking in record profits.
Now, what are some of the incentives that you saw in the health insurance industry that maybe were a little perverse and caused the customer and the agent's incentives aren't necessarily aligned?
Yeah, sure. Well, there's two things I really like to talk to employers about, and that's vertical integration. And so you've got some of these health insurance carriers, one of the biggest ones in Minnesota, right in your back door, United Healthcare. They are the insurance company, they're the third party administrator, they own the pharmacy benefit manager, they own the specialty pharmacy, they own their own mail ordered pharmacy. They, employ some of the most doctors across the United States. They really own every piece of the pie. And so that gives them the opportunity to control all transactions, but that also allows them to maximize profits as much as possible. So just kind of keeping that in mind. And then the other thing I like to talk about is medical loss ratio, or MLR, that was introduced with the Affordable Care Act. It had good intention, when, the Obama administration signed that in, to cap health insurance carriers' profits at anywhere from 15 to 20%. And so really what that says is that for every dollar that you pay in health insurance premium, 80 to 85% of that has to go towards paying claims. So that caps, the insurance carrier's profits at, 15 to 20%, depending upon how big your group is. And so good intention. But insurance carriers are not stupid. And like I said, they're like casinos, and they look at that 15 to 20% and they're like, well, how do we grow that? Because we are, some of them are publicly traded. They need to return a profit to their shareholders. Well, they're like, well, how can we inflate claims on the 80 to 85% so then we can justify raising premiums, what then increases our 15 to 20%. And so that's why you're just seeing increase after increase after increase. And health insurance carriers just really have no incentive to, lower your claims costs.
Well, that also kind of applies with the brokers as well, right? That if your pay goes up when the amount that your client's paying goes up,
Yeah.
you know, it's the
I
same
just,
thing.
yeah, I just had a conversation with an employer this last week. They sent me a copy of their renewal, and I saw right in the fine print that they were making 3.75% off a premium, and they were getting a 20% increase. So that broker really has no incentive, which did bring some other options to the table, but the client felt like he was talking them out of those options and trying to keep them with the carrier that they're with. That could have been, well, it's going to be a lot of work to move you, or they just don't understand the other options, or whatever that is. Or, yes, their commissions were going to be increasing by, 20%.
20%.
And I think that equated to like an additional three or $4,000 for this insurance agent that represented them. Um, yeah, he'd be cutting into his own profits.
Yeah. So you talked about Health Rosetta. Tell us a little bit about that and what you learned through that.
Yeah. Dave Chase is one of the co-founders of Health Rosetta. He wrote a book called The CEO's Guide to Restoring the American Dream. I actually have a big stack up here that I like to give employers. I'm very much a student of the industry because things are changing every day, it seems like, but it was a great book. And he just talks about kind of that mindset of, you know, the having fiduciary partners, that are transparent and working on behalf of you and your people, but just having a community-owned health plan, or what he refers to as a COHP, because in any given community, there's an employer, there's usually some sort of, healthcare, whether that's a hospital, independent primary care, you've got, radiology, you've got independent retail pharmacies, things like that. So how can we create kind of an integrated system for an employer in any geographic location that ultimately, all the stakeholders involved, minus the insurance carrier, because we're going to cut them out of the equation because we know what their, eyes are set on, and that's driving profitability. So how do we build a plan to benefit all of those stakeholders within a given community, to benefit the employer, benefit the hospital system, benefit, the healthcare ecosystem there, because, we need all of those players in order for a community to be thriving. And so how can we, kind of create a plan to benefit everybody in that ecosystem?
Yeah, one of the things you've talked before about is like the difference between fully insured versus self-funded or level funded, or I think that'd be really good for people to understand what those differences are and why you might consider something different than what the status quo is.
Yeah, a lot of employers find themselves in a fully insured health plan, and really what that is, you're buying an off-the-shelf product, usually from a big insurance company, whether that's Blue Cross, United, Cigna, or Aetna, or who I refer to as the BUCA carriers, where you're paying, a month-to-month bill to that insurance carrier, 12 months. And at the end of that 12 months, you really don't get any insight into how your plan performed because you don't get any claims data. So as an employer that I just paid, we'll say, $25,000 a month for these insurance plan, how do I know what the value that my employees got out of that plan? Did I overpay in premiums? Did I, underpay? Were my claims way above what my premiums were paid? And is that why I'm getting my increase? How can you justify, the increase that I'm getting? You really can't, because you don't have any oversight in the plan performance. So, I would say, there's just not a good way, of conducting business, and you're kind of prepaying for insurance. And so then kind of another step ahead would be level funding, where it's kind of like a baby step into self-funding, but you still have the protection of, an insurance carrier that's going to step in and pay claims. But instead, you're still going to pay 12 months worth of premiums. But then at the end of that 12 months, you're actually going to have some insight into how your plan was performing. And in most cases, depending upon of the level funded carrier, some will give you a surplus back, whether that's, 100% of your, unspent premium dollars or claims fund, or some carriers will do 50%, and then there's some that will give you 0%. Of course, I would not recommend doing 0 or 50. I always recommend the 100, yet we do have some insurance carriers that, do a standardly 50%. And it's like, why would I share in on the savings with this? That's my money as an employer. But that's a good baby step. And so, we do have some clients that do go in those arrangements. I would say most of them have, anywhere from 5 employees to maybe 100 employees. And we just had a client actually this past year where he's a small employer, but he got a $5,800, surplus check. back. And he's just like ecstatic about it because he's like, it's not very often your insurance company sends you a check back. And so that's a good baby step into self-funding. And then you can look at more of a traditional self-funded model where, some insurance carriers offer this as well. I don't recommend self-funding with a big insurance carrier where you can choose your own third-party administrator, choose your own PBM, completely customize your own plan. But that's when you're paying your own claims, but you have stop loss insurance. You might have a specific deductible, an aggregate deductible. So, a specific deductible, you're not going to pay any claims above and beyond that. That's where the stop loss carrier is going to step in and pay those claims. And then you got an aggregate, stop loss insurance as well in some cases, where if you have multiple people that are incurring claims over your, specific level, again, the stop loss carrier is going to come in and pay those claims. So you're always going to have that peace of mind of having an insurance company behind the scenes that's going to step in and pay claims if, God forbid we have higher claims or someone has a major surgery, prescription drug, cancer, dialysis, kind of those big ticket items. And so that's, the importance of making sure that you have, good players, not only within your self-funded health plan that are going to lower the frequency and severity of claims, but making sure that your stop loss contract's set up correctly. Because I've spoken to prospective clients that they're like, yeah, we've tried self-funding, it didn't work, our costs just kept going up. And it's like, well, once you go into self-funding, that's not the end of your journey. That's just the beginning. It's constantly tooling from year to year based off of how your claims are running. Are we seeing higher cancer? Are we seeing high MSK, pharmacy spend? And then launching, what we call point solutions within your plan to try and lower those claims as much as possible.
Yeah, thanks for that explanation. So, can you give us an example, Colton, of a company that you've worked with? Maybe tell us a little bit about the situation they were in before you started advising them, what you were able to help them do.
Yeah, I was actually just working on some case studies not too long ago with a large daycare that I was working with. I've been working with them, I think, for 3 or 4 years now. And they had a really unique situation that there was a very large employer in my marketplace that they were basically contracting with this daycare for their employees to use their daycare services, but the employees of the daycare was actually getting their benefits through a school district. And so they were, I think this particular school district had upwards of, 5,000 employees. So it's a pretty large employer and they were self-funded. And so they were canceling that contract and they were going to have to buy benefits on their own. And so they were on a Blue Cross Blue Shield plan. They took the path of like least resistance the first year. And so we just carved them off on their own Blue Cross and Blue Shield plan. And they were able to get pretty reasonable premiums by doing that because the employer was only contributing $685 towards the premium for their employees plan. So that covered, I think the highest deductible plan option for them. But then the next year, I'm like, okay, we're going to look at some alternative options. I know daycare workers, they're not highly compensated, so they definitely rely on their benefits being, prestige. And so we moved them to a level funded plan and we actually saved them upwards of, I think, 12%. And so they offered 3 plan options, in that previous year, they could only cover the cost of their bronze plan or that highest deductible option. But since we took them to a level funded plan the second year, they were able to cover two of the top or the lower end plans. And then they had a Cadillac plan that still was at the expense of the employee. And so that plan ran really well. And then I think year 3, we came in with an alternative stop loss carrier and then we were able to keep them at basically a flat renewal. And now we're on year 4 and they got rid of their PPO network. They're doing some direct contracting. And they're doing some really cool things on the pharmacy side of things. They're also engaging with direct primary care, and they were able to reduce their costs yet again. And so now their $685 contribution covers all 3 plans from the Cadillac to the highest deductible plan option. So some employers think, well, larger employers get better rates because they're larger and bigger and all these things. But in this case, we just carved this daycare out of a large employer. They only have like 60 or 70 employees, yet they're paying about half of what the school district was paying. And so it's with the right strategy that we can implement with some of these employers. Now, that's, super impactful for this daycare's bottom line.
Great. So daycare is, and share some of the different types of businesses that could be helped by these plans.
Yeah.
Can you talk about that a bit?
Yep, absolutely. We've got a manufacturer client that we just brought on that they're kind of spread out, but we were able to find, different solutions for their employees. And I think they were about the same size. I think they had 70 or 80 employees enrolled. We were able to reduce their costs well over $100,000. I got a trucking client that they've been able to maintain, half the national average in health insurance costs, um, compared against, other trucking clients. And they're, I think, only 30 employees. And then Lee and I worked on a big project with a large county. I had upwards of 300 employees or 600 members, and there was hundreds of thousands of dollars in savings there. So, I think, some of these solutions that we're deploying, are for every industry because everybody's dealing with, can't afford to have health insurance, can't afford not to have health insurance because it's just become such a large expense for employers across the United States. Even this funny but not funny, but it's like we just started working with the hospital system. And if you would think that, out of all industries or groups that you would work with, hospital systems would have their health insurance under control, we opened their eyes to a lot of different just levers we could pull on the pharmacy and, network agreements and independent TPAs, and they're in healthcare. They, are on the care delivery side of things. And so I think it was, five or $600,000 in first year savings for, 300 or 400 employee, hospital groups. I stand by what I just said. It's, some of these solutions are for just about every industry.
Right. Well, I just wanted to, Dan, tell you a little bit about how we got together, how Colton and I got connected, because, at HELPcare Clinic, when we started, we were just on that membership, that direct primary care, as Colton mentioned, is you pay the monthly membership and then you get your care and you don't have the office visit charges or the lab test charges. And it's a way for people to get most of the care that they need. But one of the barriers we were coming up against is that there were some employers who already were paying for health insurance and they were already paying plenty. And so for them to come in and then say, well, yeah, let's offer this additional benefit that's an additional cost, that just was really a non-starter with some of them. And so we were kind of limited to the really smallest employers who couldn't afford to provide health insurance at all. And what they would do is they'd purchase a membership for their employees, and this way they'd be able to give a pretty significant health benefit, but it had gaps. It still didn't cover the things like the catastrophic, the hospitalization, the specialist care. And so I participated in a webinar where they talked. There was a company called Excel Health Plans, I believe, that was part of this webinar, and they talked about how they were doing some insurance plans that were including direct primary care within an insurance plan. And I had a conversation with the CEO of that company. He said, well, I just got to tell you that if you're going to a regular broker, they're not going to make this work because it's just a lot of work. And I'll let Colton talk a little bit about this. Is a lot more work than just writing a regular kind of a BUCA plan. I mean, there's a lot more legwork involved for the agent. He said, you got to get somebody who really believes in this and really thinks this is the way we ought to go. And I know a guy. He said, I got to get you in touch with Colton. And I think while we were on the phone, he was texting Colton about this. And that's how we got connected. And so Colton, just asked you to talk a little bit about this is a lot more work. And like you said, if the regular rates are going up and you're getting a percentage of the cut, it's sometimes it might feel like it's not even necessarily in your interest to be doing all this extra work, right?
Yeah. Yeah, it is a lot more work, but there's a lot of rewards, and so that's why I do it. And I have a handful of direct primary care partners like yourself, across the Midwest, and I'm always ecstatic to, try and help out where I can because I believe in everything that, you guys are doing at HELPcare Clinic. Because me alone and some of the solutions that I'm bringing to the table, I can only reduce your claims, with the most aggressive strategies as possible, going reference-based pricing, different pharmacy solutions, cancer solutions, so on and so forth. But at the end of the day, we need, someone that's engaged with trying to get this employer, ABC employers population healthier. And then that's, where you guys step in. But it's also having the right partners and the right TPA that wants to work with direct primary care, the right pharmacy benefit management partners, the right stop loss partners that are going to give us the appropriate discounts for having direct primary care services in place. So you can't just search, a health plan with direct primary care and just expect that it's going to spit out something on Google, or you can't just look at any ordinary stop loss carrier. You can't just look at any ordinary TPA. You got to make sure that you're working with the right partners to make it work for everybody.
We really appreciate you joining with us today, Colton, and talking about how we got together and sort of the nature of the program. I think we'll have you back another time to talk some more about just the nuts and bolts of how this all works and what the elements are of a modernized kind of health plan that really gets the employees' incentives and the delivers of care incentives, as well as then the employer incentives, all aligned in the same direction.
Yeah,
So thanks for being
absolutely.
with us.
Thank you.
Thanks, Colton.
Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with HELPcare with your friends and on your social media channels. At HELPcare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the HELPcare Clinic difference at healthcare.health.